we're very excited. We have 38 people with us today. And we have some really great speakers. We're excited about that, and a really good pertinent topic, given our COVID-19 circumstances. I am Carol Lincoln. I work with the DAP Community Network. I'm the provider co-chair of the DD Council and the co-chair with Jackie of this committee, the Family and Provider Information Committee. And I'm very excited to see that we have some care management people on here, because I used to co-host the MSC committee. I want to see care managers represented as much as possible, because we know that they are a big part of getting services for ourselves. So Jackie, go ahead, introduce yourself.
Jackie Cianzo, my thing's up as snack. I'm a mom of a 25-year-old young man with autism, and who's at home with us. He gets services from, I told Eric already, from Chinese American. He has CDPAP, that consumer directed personal assistant plan. I co-chair this committee with Carol, rather poorly. Carol does all the work. I'm very grateful to her. So I'm very excited about this topic. At SNAC, many families have asked me, how do you get home services? And like you say, especially with the COVID situation, it's become even more relevant.
So we decided, since we have 3 speakers who are going to be obviously introducing themselves, we decided to not do formal introductions in the beginning, because we want to give them a chance to really have the time. But if you do have an announcement, or if you have something to say, please put it in the chat room. And I ask that everybody take a peek at the chat room, all the amazing announcements that I'm sure you guys have. Does anybody have any issues, any concerns, any questions before we get started? Right, I'm ready to go right to the
And
topic.
just a reminder for those of you who may have just come on, we're going to be recording this. So if you have an issue with that, please take your picture out or whatever. Okay. Thank you.
Now, Eric and Rachel, one of you want to go first, or did you have a master plan? And Lynn, I know that you were going to be the advocate in terms of helping families negotiate afterwards. So Rachel and Eric, I'll leave it up to you.
Maybe technically, because somebody's sharing the presentation on my end, it's easier.
Say it again. You want to go first?
It doesn't matter, because I know Eric's sharing his screen and you guys are sharing for me. So whatever's easier technically, maybe we can do it that way.
For me, there's nothing easy technically, so that doesn't matter.
I didn't want to say that, Carol. I was trying to be kind.
Since you're here now.
Today.
Hi, Debbie.
Wait, remember to mute
I
yourself.
have 2 meetings at the same time.
Right,
Emily,
remember-
you need to mute yourself. Everybody needs to mute themselves, please, unless you're speaking. Thank you.
And not to sound pushy, but if I might mute you, so don't get insulted if I do mute you. Okay, it's nothing personal. Okay, so you guys decide. Rachel, I'm ready whenever you are.
Yeah, Eric, do you want to? I don't care, because I'm going to be on either way. Eric, do you have a preference? Otherwise, I'll go first, since Carol could share the screen quickly now.
You can go first.
Okay, thank you. All right, Carol, you ready? We're going to do this. Awesome. Hi, everybody. So I know most of you, and a lot of you know me. I'm so happy to be here. Thank you, Jackie and Carol. So my entire career, I always like to be part of the solution, because there are a lot of problems navigating systems and trying to advocate for your children and your loved ones and the people we support. We like to have solutions. So I feel like Eric and I being here amongst what is going on in our world is very important, because we can provide solutions fast and help pretty quickly. And we're all not used to that. So just a little bit about my background. I was with the provider agency for a really, really long time. I know I look young, but I've been doing this since the early 90s. I was part of an OPWDD provider agency. I've been around a long time. I was started when things were called CM They became MSC, and then it turned into CCOs. I was very much a part of the development of one of the downstate CCOs, very involved with Manhattan, Staten Island, and Queens. So I know a lot of the families and a lot of the providers. During COVID, a lot of the families that I worked with over the years were calling for help. Their children are home. They're trying to work from home. They're trying to take care of elderly parents. Everybody's world has been turned upside down and inside out. Partnering with Amerikids has given me the opportunity to help families get services in the house and really help the family as well as the children that we support. So we'll go through the slideshow quick. I also want to introduce Calvin. Calvin, can you just unmute for a second, say a quick hello? Calvin also comes from, there you are, hi. Calvin and I have the same background, provider agency, CCO, and now with Amerikids. So in helping families get supports and services in the house, we also help them with a lot of OPWGD stuff also. Calvin has been a huge blessing to me because we are very busy and I needed somebody who knew how to navigate this very complex system at times, and he's able to do that. So thank you, Calvin. Want to say something before we start?
Hi, everybody. Hi, Jackie. That's it. I didn't really want to say much. I'll let you speak.
Thank you. So Americare is a very, very big home care organization. And the pediatric program started just a few years ago. So currently we serve over 400 children aged 3 to 17. Next slide, please. Thank you. Okay, so where we provide services, 5 boroughs, Westchester and Long Island. Nassau County only currently. Suffolk County is a little hard to staff because there's not a lot of public transportation. So we're not really confident in saying that we provide services in Suffolk County at this time. We're available 7 days a week, 24 hours a day, to answer your questions and get you the care that you deserve. So in addition to me, Calvin, being the first contact you have at Amerikids, we also have a 24-hour customer service hotline for the family. So if something was to happen on Saturday or Sunday, you could always get somebody from our nursing team on the phone. We have flexible schedule to assist, especially now with, schools are open, schools are closed. So we try to be as flexible as possible with the staff so that families always have somebody that they know is coming in. Okay, right now, this is what we're providing in home, in person, not Zoom, a real life person. And we'll get to the ED protocols in a little bit. Providing nursing, PT, OT, speech, and home health aid. All services are provided by compassionate caregivers who are trained to work with special needs children. Just a little bit on that. In addition to our home health aides getting a regular certification that's required by DOH, we have an extra component to work with children with behaviors, children with autism. We also partnered with another agency that has.
Mine.
I'm sorry?
Wait, Rachel, I'm just going to say, there's some interference. Please make sure you are muting your mics. Even if you're on the phone, you do have to mute your phone. Sorry, Rachel.
That's okay. So we are working with another home care agency that specializes in working with children with severe behaviors, and we have a behavior plan, somebody writing a behavior plan, working with the aides, helping the caregivers of the families with dealing with children with significant behaviors. So that has been extremely helpful, and we're having great feedback from the families with that partner agency that we're working with. Okay, so right now, these are the languages that we have, and we're adding to it all the time. So these are the aides, not the therapies, that speak these languages. So, and there's a lot, as I said, and it's ongoing. The creative way we're able to staff any household with any language that is spoken is by hiring relatives of that family, neighbors, somebody from church, synagogue, etc. So if there's a language that the primary caregivers speak and we don't have staff, we will train and hire somebody that the family chooses. Same background check, same DOH training, but at least we're comfortable saying the family can communicate with that home health aide. Okay, so the challenges of remote learning for students with IDD. Remote and hybrid learning has created hardships for students and families. I think we all agree on that. Teachers, therapists, carers are roles that sometimes cannot be easily filled by parents who are also figuring out remote learning, working from home, or have other children in the household. Just me, myself, just working from home during the pandemic and having my children here, it's not easy. So now, you know, with a child with a disability that requires additional attention, might not sit for the Zoom, really having that extra set of hands in the house we've been told, has helped tremendously. You know, a lot of the kids that we support might not even go on time, and parents might be, you know, doing other things in the household that they cannot sit with that child, making sure they're on their Zooms. So the home health aide has been extremely helpful. As far as the therapy, sometimes Zoom therapies are really not consistent for our kids, or not enough. So having that extra person in the house supplementing the services that are coming from the school has been very helpful. We do not replace, we supplement. You're getting OT, PT, speech in the school, we're giving extra. And that plan is followed by the people that we're sending in. The therapists know they're following whatever's the school's working on. Same thing I spoke about, remote learning. Schools can't always commit to provide the full amount of service that's outlined on the IEP. That's where the supplement comes in. Amerikids is committed to supporting these families and students with all in-home services, which may be needed at this very difficult time. Next slide, please, Carol. So this, very important, PPE. During the pandemic, AmeriCare delivered PPE to all the homes to make sure that when the aide or the clinician arrived, that it was already there. So there wasn't scrambling to make sure that whoever was coming in the home was safe. There's ongoing testing available at our offices. So families that request ongoing testing for the aides, we have it. We also had started the second set of vaccines already, first for the staff. So those are the precautions that a lot of parents had concerns, understandably, of how we were dealing with COVID, and it's an ongoing process, but all the precautions are followed, and families can request additional precautions if they choose. Referral process. Okay. Anybody that knows me and Calvin knows that we work a lot and we get back to the families as quickly as we can. We know that these services are very much needed, so we try to move them along. There are a few obstacles, like we know sometimes there's some Medicaid issues, or the doctor's not getting back to us, but we do the best we can. We work with the care managers to get this done as quickly as possible. So we do provide services up until the 18th birthday. Medicaid is unlike OPWDD or the Department of Education. Things change at age 18 and not 21. So from 18 on, there's another process for home care in the home, and we do make that referral. So it's there's no lapse in services, but me and Calvin's program is from 3 to basically support is given till 18, but we accept referrals up until 16. The Medicaid funded service the child should have or be willing to apply for Medicaid. Although OPWDD does not approve or facilitate our service, the child must be known and eligible to receive OPWDD services. It's a code 95 that would appear on the child's Medicaid. Also, if they're part of one of the CCOs, they would have eligibility already. We do help children that are coming out of EI to get the eligibility, get them to a CCO. That's a service that we provide because Calvin and I have the knowledge to do that, and it's very helpful for the families. You must have had a recent in-person medical appointment within the last 60 to 90 days of referral. That does not have to be an annual. It could be a sick visit, flu shot visit, COVID visit.
Rachel,
And-
you say in person, so that means telehealth is not,
No, I was just saying that telehealth is still accepted by Medicaid because that's a Medicaid rule, not ours. They're still accepting the telehealth as a face-to-face.
Yeah.
Okay. Upon receiving the referral, our team will immediately work with the team and family to expedite the start of these very important services. If the Medicaid is good and the doctor's office is responsive, we could turn these referrals around in days. You know, I was saying a week, we now have them down to days. So as long as the doctor's office doesn't keep us on hold for 2 hours, we're good. Or we multitask while we're on hold. But doctors have acknowledged how important this is. Families have expressed to their pediatricians that they need these services, so they're getting the information back to us. We have partnerships with all 3 downstate CCOs. So we're able to work with the care managers, the intake team, depending on where the child is in the process. A child coming out of EI, we'll get them to the CCO. So simultaneously, while we're getting them services, they're going to get a care manager. It's very helpful for the schools, right, to have Calvin and I helping them work. So at least you're not waiting, you know, for respite or ComHab. That could be time consuming if you're not yet part of a CCO, right? So if you're not part of a CCO yet, intake, get the care manager, IM, life plan, OPWD approval, that could take some time. While the families are waiting for that very important service as well, at least if there's an aide in the house, families can have, you know, instant support. So here's my information. Calvin is CFRASER at AmericareNewYork.com. We'll put it in the chat as well. If you go on the Americare website, which we are going to put in the chat, and we have a referral link already there, it's probably best that you just email one of us as well with the circumstance of the case so that we can go through it. And then we ask for the demographic information on our referral link so that we could start working with the doctor, making sure that we are set up to have, you know, clinicians in that borough or area. But we are always available to answer questions. And families call us all the time. It could be somebody over 18, we help them, Medicaid, things, all different, like even some kind of care management questions that we have that we can help. And we
that
get
was something I was going to ask, Rachel.
Sure.
There is no service in America, was it, they're bigger agents, you know, on the umbrella for adults, or no, it's just kids?
So we're only doing the kids.
Right.
It changes with the MLTC for over 18.
Right.
But we do help the family. So if you called with the situation, we will get you to the right department and
Okay.
follow the case along till we know. But over 18 is either MLTC. Over 21, you can go to like a organization like Partners Health Plan, but that's 21 and over. So from 18 to 21, there's that little gap where you have to get home care services from CASA, which is an M11Q,
Right.
or have an MLTC. So we will work with you on whatever circumstance works best for the household, which doctors you're involved with already, because that's where it gets a little complicated. You don't want
Right.
to change into an MLTC if your doctor doesn't take it, if it's a straight Medicaid or vice
That's
versa.
generally the issue I find is most people just don't know where to start for this home care piece with the CASA piece. And, you know, it's been so confusing. You're going to help. I can't imagine how many people you're helping already.
Happy to do so. Yep. No, we're happy to do so. And that's what I said, the partnerships, the relationships that we have, it's pretty important, right? Because, you know, the different councils and just being part of a CCO. And I was part of provider relations at a CCO. So those relationships are so helpful because we're able to, whatever families are not even coming into our program, we're able to refer them elsewhere. So do you want to read the questions in the chat, or has Calvin? Okay. Okay, so I see that there.
I think
I'm sorry, I'm
I
just
don't,
looking for
I
it.
don't see any questions really. I just see people introducing themselves. I guess we
Oh.
could do questions at the end, Carol, right? Unless anybody's got something right now for Rachel or Calvin.
Sure, I have one, if you don't mind.
Yeah, who are you?
My name is Catherine Hoy, or Kate Hoy. I'm from AHRC.
Okay.
Thank you so much for that great information, Rachel and Calvin. I work with students 3 through 21, and you mentioned the OTPT and speech at home, and I apologize. I was taking notes, and I feel like I missed the key piece of information. So you work with the plan that the OT or PT provider at school has created. Did I hear that correctly?
Well, yeah, so if there's an ongoing plan, they're not going to start a new one and disrupt any of the services that are going on at the school. So that's where like the team approach comes for the clinicians, our clinicians to work with the clinicians at the school so that there's, you know, not two messages or two sets of plans being followed.
I know, it makes
yeah,
sense, but I see it. I see it all the time. What you're saying makes perfect sense. So if they cannot get in touch with that person, or if say the school hasn't yet provided a therapist, as has been the case right now with COVID,
Right.
do you create your own plan? Would you?
Yeah. And then they would share it. Then it would go backwards. Then they would share it with the school when they do have one. So those therapists have, well, from the feedback that I'm getting, because I'm not there, you know, very good with communicating with the school, with the parents, with the care manager, only so that, you know, everybody's on the same page, especially with the therapies, right? A lot of children have had nothing for months and months and months. So where do you pick up from? Having the communication with the school is key for those therapists to even know where to start.
Great.
Right?
Yes.
Because after March, so from March on, some children had nothing. Some children did not have access to technology, unfortunately, and didn't start getting services till this school year. So with that lapse, the more the better, right?
And one more, if you don't mind, how are the number of hours determined?
That's on a case-by-case basis with the nursing staff. Yeah.
Great. Thank you.
Okay.
Any other questions or?
Catherine, can you email me your information?
Sure, no problem.
Yeah, because we work with a few of your schools already. I want to see if it's something we could set up.
Great.
Okay, looks like we're moving right along to Eric. Eric, we're ready for you.
Hi, everyone. My name is Eric. I work with the Chinese American Planning Council Home Attendant Program. We manage the CDPAP program and as well as the traditional home attendant services. I will get into the CDPAP program in detail shortly. But just to associate a photo with my name, I couldn't get my camera working today. Here's a picture of myself. I'm sorry. I realize I'm not sharing my screen. Let me share my screen first.
I got Eric Chen now. Yeah, Eric Chen.
Can everyone see my screen?
No.
Go Eric Chen.
Okay, here we go.
Yeah, it looks like it's happening now, Eric.
Okay. All
Oh
right.
my God.
There's our logo.
Yep.
Got it. So that's our agency. We've been around since 1980s.
講下卡手單聽下，話茶會嘅啫意思。你要參加呢
Right.
個
So I think someone's speaking at the same time. Can if you're not speaking, can you mute your phone? Thank you. Appreciate that. So let's see. That's me. Right. So sorry about that. I couldn't get my camera working today. Right. So let me start off by saying that our CDPAP program has been around for 40 years and going. It's not a publicized or well-known program at least until now. It's legal. It's perfectly legal for a relative or family members or anyone, the patient, the consumer, to hire their loved one and have them care for them and get paid. You'll be surprised. A lot of people find this surprising that one can care for a loved one and get paid for. But it's, like I said, it's been legal for 40+ years and going strong. We are a licensed home care agency as well, short for LICSA, serving the 5 boroughs, been around since 1983. Our mission is here. Our mission is to provide culturally competent individuals quality of home care services by promoting independence, dignity, comfort, and compassionate care for clients, consumers, while ensuring safe, respectful, and dignified working environment for home care employees and staff. So although the name of the agency is Chinese American Planning Council, we are a diverse clientele organization. Our clients come from all walks of life, all ethnicity, racial backgrounds. You will see in the later PowerPoint presentation breakdown of our composition of our clients or consumers. So right now we serve about 3,000 clients and consumers. We call them clients for those who receive an aid from our agency, and those who are consumers receive CDPAP services. So the benefits and wage, I will get to it shortly. This is an introduction. Here's our CEO, along myself, I'm here. This is my extension, my telephone contact and extension. I will give my email later on for anyone to contact. And you can also reach out to us via our website. There's a form on our website for intake if anyone's interested in CDPAP services. There's more contact for our staff. So the aides that we employ, this is a breakdown of our aides. As you see, Asian make up 1/3 of our population. The other 1/3 is Hispanic, Black, or African Americans, and other white or non-white employees. I'm just going to skip these photos here. Okay, so this is where the composition of our clients and our consumers. As you see, the majority of our clients are non-Chinese. Right? The Chinese population is only 18%. You see 17% of Hispanic or Spanish speakers, English, and other non-Chinese. So with regard to minors, you will see that 16% of our clients or consumers are under the age of 20. Okay, so we do have a big part in serving the minors. It's a breakdown of racial backgrounds for our consumers or our clients. So I'm going to pause and stop at this point. Does anyone have any questions before I move on to the wage and benefits part?
Can you, it's Jackie. Let me turn my camera back on. Eric, can you speak a little bit about the process of how people, did they have to do intake to you directly, or is it through CASA, or what's the deal?
Yeah, we do have on our website, there's a form where one can complete to forward their information to us.
Mm-hmm.
So the basic criteria is this: Medicaid eligible.
Mm-hmm.
Medicaid eligible, and you do have to have someone managing the care. If this is a minor, there must be a guardian or parent involved, or any representative involved.
Right. So they should start with you. And then if they're adults and, or Rachel, you know, well, because for this whole thing, anybody can reach out to any of you to get started with how to get home care if they don't have it currently. Yes?
Yes, correct.
Okay. That was all.
Okay. So let me just speak briefly about this form. Just complete this form, send over your information, most importantly, your Medicaid ID. If you don't feel comfortable with sending us your Medicaid ID, that's okay. Just give us a call or send over your information, and we'll be in touch with you within 48 hours. So in addition to Medicaid, we also accept managed care Medicaid for those who happen to enroll with one of the managed care organizations. These are the plans that we are contracted with from A to Z, basically Affinity. The most well-known ones are the Visiting Nurses of New York, Metro Plus, Health First, Centers Plan for Healthy Living, Empire Blue Cross Blue Shield, Emblem Health, Montefiore Diamond Care, which is based in the Bronx, Senior Health Partners, United Healthcare, to name a few. So I believe if you're a minor, you are most likely going to be a straight Medicaid. So we help you with applying for, especially for those who are straight Medicaid. We've been doing this for a long time, and we are very experienced. And in general, we get about 20 referrals a month, and out of the 20, most of them do get approved by CASA with our help for CDPAP services. So I'm gonna move. You'll find that on our website, it has tons of information about the CDPAP program. If you go to here, home care, this link, hover above this link, if you go to Consumer Directed Personal Assistance Program, there's a ton of information here. It introduces what CDPAP is about. It speaks about, it discusses about the roles of a consumer, the personal assistance role, and our agency's role. So our agency's role is to be a fiscal intermediary, the FI, in which we manage the payroll and also the fringe benefits. Speaking about wage and fringe benefits, you can go to Jobs and Career and just go to hover on this link, explore our jobs and careers. Go to the middle, you will see this link, number 2. This is for our regular aid. Number 2 is where we are going into detail about personal assistance wage and benefits. Okay, the hourly wage is $15 an hour on weekdays and $16.10 on weekends. Now, as I mentioned, we offer health insurance benefits, and the health insurance carrier is Oxford United Healthcare with Oxford, which is one of the best in the industry. It's the plan that we have is comprehensive. It covers A to Z. It covers dental, vision, life insurance, you name it, and we have it. And the best part about the health insurance is that the monthly premium is about $36 a month. That's right. And for individual coverage, $18 per person per payroll, PPP per person per payroll, $18 per payroll. So that makes about $36 a month, and includes dental, vision, and everything else. For spouse, you would it's an extra $200 a month because it's $110 per payroll. If you have children, doesn't matter the number of children you have, 1 or 5, the premium is about $160 per payroll, so $320 a month. So if you compare the fringe benefits, the medical benefits with the industry, with the market, ours is one of the best, if not the best. Not mentioned here, the insurance, the health insurance has no deductible. That means that if you're ever hospitalized, God forbid, you don't have to pay out of pocket for deductibles. Some insurance will make you pay thousands of dollars first if you're ever hospitalized, but ours has no deductible. Now, going back to the wage, if
Eric,
somehow
Eric,
the spouse, yes.
There's
yes.
a question in the box. Can the CDPAP, the provider, the aid, be older than 65?
Yes, there's no age. Actually, as long as you're over the age of 18, you can be the aide.
So there's no age limit, and you have to just be 18.
Yes. So
Okay.
also for consumers, as I was saying, you could hire anyone, just about anyone, except a spouse. That means you could hire your grandchildren, grandparents, cousins, siblings, neighbors, friends, just about anyone, except a spouse. Now, if the child turns over 21 or older, their parents, the child's parents, can also be the aide.
And is there anything about the guardianship situation with that? Can you not be the guardian or there's always a lot of hubbub about that. There's always people asking that question. If the parent
Yes.
is,
as far as I know, yeah, I get that a lot too, but this is why I tell consumers or potential consumers, as far as DOH, New York State DOH is concerned, the designated rep cannot be the aide, right? Right. What happens if you're also the guardian, right? But for the purpose of CDPAP, if your application says that you're not the designated rep, you can still be the aide. So you can be the guardian.
But what about single parents? That's the thing I get all the time. People where they're the lone parent, so there's not another parent, and they are the designated because there's nobody else. So that's kind of like, tough. But just a question. So you gave the answer. I guess we can't change the rule, but that's the question that comes up a lot.
Yeah.
Jackie,
right.
can you hear me?
Yes, Lynn.
The answer is that you can't wear two hats at the same time. So even if that single parent is effectively wearing two hats, but to be the paid worker, they need to find someone else in their life. Could be their neighbor, could be their sister across town, could even be somebody who's across a state line, as long as they're reasonably nearby, who's going to perform the role of being the authorized representative.
Okay.
And the reason is that you can't be your own boss. You can't you can't sign off on your own hours.
Right. That makes sense. That's a very good suggestion. is just because you don't want to outsource the job. You want the job, but you
What?
could
Did I
easily
let
have
me
somebody
do
else be
that?
guardian.
I don't know.
Not sure.
Hey, Emily, you've had your hand raised for a minute. You must have something you want to ask. Emily, are you there?
No.
Oh.
Yes. Can you touch the door?
Yeah,
Emily, I think
so
you need to mute. Okay. So
yeah,
Andrew Harris is saying there's a lot of misinformation out there about the authorized representative versus the guardian role. So I think as care managers and everybody who's on here, provider-wise, the more everybody educates themselves about giving that information to people, like Lynn just said and Eric just said, the better. So that's how we get rid of misinformation, right? And then come up with a solution like Lynn just did. Okay, sorry, Eric.
no, that's okay. So moving on to the wage, as I mentioned, for those who join our health insurance, we do offer a comprehensive health insurance package. For those who don't, what about if you have a spouse who covers your insurance, your family? So you have the option to opt out. If you opt out of our health insurance, you will get an extra $2.30 an hour. So that means the base wage plus $2.30 for weekdays and also for weekends. However, the only catch is this: the $2.30 won't be paid upfront. However, it will be paid a month later. We need a 1 month period to verify your underage insurance status, and also to sum up or add up all the hours worked. About a month later, if you opt out of the insurance, you will get not a separate check, but you will get the balance of $2.30 times, let's say 80 hours worked. You will get the sum on top of your existing paycheck. A lot of applicants find this very useful and to their benefit.
That and the overtime. You guys are very liberal with the overtime too, which is very helpful.
Yes, the overtime is $22.50 if you work over 40 hours a week. However, due to constraints, we're now trying to cut down the overtime expense. So again, if you go to our website, gpchap.org/career, you will find lots of information here.
Couple of questions in the box here. Do you work with consumers with self-direction? This is separate than self-direction. This is a separate service. Is that right? So yes, you can have self-direction and you can have CDPAP.
Yes, as long as there's no conflict of schedule.
Right. Then it says, I have a 22-year-old. Can families have a home health aide with this service? My daughter has straight Medicaid and Medicare. So that would be yes, yes?
Of course, of course.
Yes, that's Maria. And I have a 10-year-old daughter with special needs, someone's saying. So that would qualify also. And someone asked, is this HHA or an assistance? Home health care aid. We're talking about consumer directed personal assistant. That portion is what we're talking about of this service. HHA is a home health care aid, isn't it, Eric?
Yes, HHA is where we send in our certified home health aid to a client.
Okay. Now someone's asking, can the agency help find a backup for the PCA?
For the CDPAP program?
PCA, they said,
Yeah, for,
personal care
I think
assistant.
the person
Yeah.
is referring to CDPAP.
Yeah, I
But
do
for the
too.
purpose of CDPAP, you are in charge of hiring or terminating, if necessary, an aide.
Right.
So we do not provide any backup, but we do have a database, and on our website, it's called Online Recruitment, where you can register for an account, and potentially available aides sign up for this website. So you can
Right.
search for an aide here on Online Recruitment.
I have the service, and what I do is I have a couple of people signed up, so I do my own backup. I just find that's a little bit easier. What's the difference between aid and personal assistance?
The aid is where we send in our certified aid to the client.
That's where you don't hire your own person. That's different, right?
It's very different.
Right.
From a legal perspective, it's very different.
So this is Carol. So we have a situation where families are at home because of COVID-19. The kids may or may not be going to school. Families are doubling up. I'm assuming that there are families on this meeting that have questions. Will this work for me? Should I be looking into this? I want to make sure that those issues are addressed. So if I'm the mother of a child and I'm homeschooling and I'm working from home, can I apply for CDPAP?
So if your minor is under the age of 21, unfortunately, the parents cannot be the aide, but you can hire other family members, such as siblings who are over the age of 18.
Or your caregiver.
Or other relatives.
Usually you have a caregiver, but people have, babysitting or something of that nature. Anyway, normally that person can become this, and it helps offset the childcare cost.
If my child is over 18, I can become the
Over 21.
Over 21, I'm sorry, over 21. And I could apply for this, and I can, what if I'm already working? Can I also get income as the PA for my child at home? What if I'm at home working with my child at home? Can I also benefit from this?
Yeah, weekends.
Yes,
any other
if
times
your
that-
child, I'm sorry. Yeah, if your child's over 21, the parents can be the aide. Even if you have a job already, if you find the time and the energy to care for your child, and at night and you want to get reimbursed for it, it's perfectly legal. In fact, CDPAP is perfect for doing this time, because you can hire individuals with known status, with known negative COVID status.
Dixon Chen, you have a question.
Yes, I have a question. If the individual is under 18, but he has an older brother, who is older 21 years old, it's possible the older brother can be the provide a service to the brother, but they live in the same address.
Yes.
Okay.
Yes, within the same address, it's also allowed. It's also permissible.
Siblings are perfect.
Okay, great. Thank you so much.
In many ways.
Can I ask a quick question to Eric, Jackie?
Mm-hmm. Go ahead, Joel.
Eric, you said it is Joel Weinberg. You said that there is overtime pay for over 40 hours. My question is, because we are on CDPAP for our child, we're allocated more hours than 40 hours, but our care worker could only work a maximum of those 40 hours. So are you stating that you could get overtime if you're working for multiple caring for multiple people?
Yes, we have been paying overtime in the past, but due to recent financial constraints, we're trying to cut it down. We're trying to cap it at 40 hours a week.
So the CDPAP healthcare workers could only work a maximum of 40 hours a week.
Yes, correct.
Correct? Or is it only 40 hours per each person?
It has to do with the individual's hours worked per week. So it doesn't matter if you work 3 clients or 4. If your hours are over 40, then we're gonna ask you to cut it down to 40.
No, I understand what you're saying. We have more than 40 hours a week allocated, but we could only use one of our healthcare workers for a maximum of 40 hours a week. We can't, that healthcare worker cannot work for 50 hours a week. You know, it was only to more, so that's why I was asking, how is there overtime if she's not able to work more than 40 hours
Is
for my
Chinese
child?
American, is Chinese American your FI? Joel?
No,
Okay, that might be,
you don't
He's
have, you don't have an FI. We don't have an FI for CDPAP.
You absolutely do. You
Yes,
just
you
may
do.
not be aware who they are.
Yeah, you must.
Oh, no, correct. I am sorry. I do have an FI. I was just mixing up something in my head. I just
Okay.
happen to deal with the city a lot on this more than the FI. We have Hamaspic for our FI, but this didn't come from Hamaspic. This came from the city care manager, whoever they put in charge of his program.
I don't know, we could talk about that offline, but
That's
that's
fine. That's fine.
okay.
Hi, hello. I just wanted to clarify. My name is Monica and I'm from Tri-County Care.
Mhm.
I'm a care manager supervisor and I've dealt a lot with this situation like Joel has stated.
Mhm.
And from what I understand, every agency has their own rules when it comes to overtime. So if the agency allows the person to work overtime, that's wonderful. But a lot of them are not, as Eric has been stating, they've been cutting back. So in that case, that one worker can only work the 40 hours and then the rest of the hours that are allotted to that individual will then go to whoever you have as maybe a backup or a second option to get those other hours. Or in some cases, I've seen that one person will then just work under a different agency to disperse the other hours that are over 40 for that same individual. So if you wanted to keep that same person, but they can't get the overtime from that first agency and they can work on
Sign them
another.
up elsewhere. Oh, that's a good idea.
Yes, so those are the different
You
options that
trickster.
have been, well, that's what's been presented. That's what's been presented from some agencies. So if that, works for you,
helpful.
Joe, right?
No, I understand. I understand. I didn't even know you could be on 2 different agencies on the same, on like CDPAP with 2 different FIs.
It's a crazy world.
Yeah.
It's the government.
Well,
It's up even more.
Well, yes and no. If having 2 FIs is solely for the purpose of evading wage and hour rules, then you will ultimately get in trouble, right?
Right.
You can, and I see this all the time in the broader world of chronically ill and older people with home care, have some hours of their total schedule in the traditional way from a traditional agency, which could be Chinese American because they are in that business as well.
You mean like a home health care
and
aide?
some, yeah,
Tradition.
well, the whole, no, just traditional personal care. Traditional personal care is part of their week, and self-directed personal care is another part of their week. So they could divide their authorization with the 2 flavors of home care. And then home health aid is another. Home health aid is about the scope of practice. Home health aides can do a few things personal care aides can't. They can take blood pressure. They can take temperatures. They can, you'd think that weighing wouldn't be too technical, but home health aid, or pardon me, personal care aides are supposed to help with activities of daily living and not provide health care. Right, so then there's a next step up, which is home health aid, and then on to licensed practical nurse if you really need a nursing grade task. So think of it as 2 dimensions, a kind of a scope of specialization and clinicalness, up, down, and then across. Traditional personal care has very strict limits on what they're allowed to do. Consumer directed aides can do a few more things that the family has trained them to do. So there's this is just an absurdly complicated access and capability matrix. But we probably want to let Eric make sure that he's told us everything he wanted to tell us.
Yeah.
Eric, there's a question for you. Is the agency cover all medical testing checkup for CDPAP person in case they don't have medical insurance? I'm assuming they mean for the person who's going to provide the personal assistance.
I'm sorry, what was the question?
Is the agency covered all medical testing checkups for the CDPAP person in case they don't have insurance? So if they don't have insurance,
You mean like when they start? Because they could get insurance through CDPAP, but initially, like if they have to have an exam, yeah, they send them to a place, right, Eric?
Yeah, we do ask for a pre-employment medical exam and also an annual, and both are paid for by the agency.
Right.
okay, good. That answers the question. Thanks, Eric. All right, Eric, we caught you. We snagged you in the middle here. I want you to be able to finish your presentation.
Thank you. So let's see, wage and benefits, $2.30 an hour extra if you decline our health insurance. So the other benefits are just like other jobs, any other jobs, you do get paid annual leave and paid sick leave. So the math is this: for every 26 hours that the aide works, they get 1 hour of sick leave paid and another hour of annual leave paid. So the more hours you work, obviously, the more hours you can accrue. Now, for the annual leave, if you've saved up hundreds of hours unused at the end of the fiscal year, which for us is July, you would get a separate check. So if you have 200 hours accrued, you would get a separate check by the end of July each year, paying out the unused or accrued annual leave. Unfortunately, it's not applicable to sick leave. If you don't use the sick leave, you lose the sick leave. Okay, so moving on to the holidays. On certain major holidays, you will get, if you are scheduled to work and you work, you will get time and a half on these holidays. For other benefits, they are benefits such as paid jury duty. If you happen to be called upon for jury duty, you will get reimbursed for the entire duration. If you're there for 2, 3, 4, or a week, we will reimburse you for your time served as a juror. Excuse me. And for those consumers, this is a big part. If you decide to have your aide trained for a certificate, we do reimburse you or the aide for training up to 40 or 60 hours for a certificate training. And your aides are covered under workers' compensation, disability, unemployment insurance, and family medical leave. As you see, there are other benefits. Details.
Eric, I'm sorry, there's
here.
one question about how many hours do you have to work in order to qualify for all those benefits?
Yes, for health insurance benefits, it's 80 hours a month. So if you work at least 20 hours a week for 4 weeks a month, so that's 80 hours a month for 3 consecutive months. Initially, starting out for 3 consecutive months, of which each month is 80 hours a week, you will be enrolled with health insurance, with our comprehensive health insurance. The last part about our fringe benefits, there's a pension, a 401A that we save up for our aides, and it's vested immediately. The algorithm for that is not publicized, but after working so many years, you will have a nest of a pension that you can take it with you, or or withdraw when it's matured. Okay, so with that concludes my presentation. Are there any other questions that you have?
I have a comment. I had no idea that there were so many benefits to becoming a PA. Now you have to kind of wonder why more families don't take advantage of it, that it really could lead.
Because like I said, Carol, nobody really talks about it. You know what I mean? It's like, well, we really needed to do this. I'm so grateful to you guys for putting this together. It's we've tried to help so many people. It's great. And really the benefits it's really wonderful for these people who work so hard with our kids, Yeah. Garrick, that was really terrific. I'm very grateful.
Wait, Sister Eli, you have a question? Oh, the backup is a heart. Yes, agreed. The backup is obviously.
It is, but that's us. We are the backup. But at least in this case, you can, there's always a big issue. Definitely.
Yeah, you can have a family member who's in college who can make a living at home and still get his studies done. And, there's a lot of creative ways in which to use CDPAP, especially during this COVID-19 time, where really everybody benefits in some way. So I really hope that for anybody who didn't know about it, they now know about it. And Lynn Decker has been putting parts of her presentation in chat rooms. And I know that she has a tremendous amount to say. And Lynn is just one of those incredible advocates that, in my personal opinion, seem to know everything. You might argue with that, but it's just it's my personal opinion. And she is here, I think, to give advice to families based on experiences that she's had in working with families negotiating these systems. And Lynn, go ahead and you can continue your introduction.
Lynn, can I just ask you one thing? Somebody just put up 2 quick questions. Does Chinese Americans serve New York City only, or can Long Island and Westchester qualify?
Depending on your insurance, if you have a managed care organization's Medicaid, then we can cover Nassau or Suffolk.
Okay, so not Westchester. Maybe
Westchester too.
Okay.
Westchester too, depending on your insurance.
Okay. And so Dixie Chen has another question.
Yes, I want to know about that. If the CDPAP program, it is possible they provide a certain of the training to train the people who is doing the care about the people. They provide a training or no training?
Well, you usually hire the person. Yeah, so it's no training.
Yeah, there's no training provided, but we do pay for your aide to get trained. Your aide can go and get a certificate and come back to us with the certificate, and we will reimburse your aide for the certificate.
The hours.
So do you provide those information to the people so you can let them to go to do some of the training, or you have to let the worker who they find their own training way?
We do have a few agencies that are well known. If you ask us, we'll give it to you, but we do not ask your aide to get trained because training is not part of the requirement for CDPAP.
I got it. Thank you.
And Carol, are we going to be able to share this, the chat information? Because there's a lot of stuff in there.
That's a technological question.
Maybe Andrew can help us.
Well,
Andrew left.
at the
Okay.
end, at the end, I can capture that chat file. But somebody will need to prune pick out the
That's fine.
salient items that you want
I'll
to
do
save.
that. If you would save it if you would do that, Lynn, and I'll take care of it. Thank you. Now, please go ahead. I'm sorry.
Sure. All right, so I want to share my screen so you can see my brochure.
I'll have to
Let's see if I can do that.
We make you a co-host.
She's going to make you a co-host.
All right, you should be good to go now, Lynn.
You are the co-host.
Okay. And are you guys seeing a brochure for ICAN?
Yeah.
Yes.
It says get help with managed care. All right, so
Yep.
I apologize that this layout is not terribly screen favorable. This is meant to be a trifold brochure that I would hand out at expos and things like that. So I just want to give a brief background that Independent Consumer Advocacy Network is funded by a grant from the Department of Health, and we are available to advocate for people who get their long-term care, such as home care, from a managed care organization, either a Medicaid managed care plan for people who have only Medicaid for insurance, or a dual managed care plan for people who have Medicaid and also Medicare. We are available in a very limited way only to people who have straight Medicaid and are seeking home care. I can give you advice and point you in the right direction, but I won't be working on appeals for you or going to fair hearing with you if you have straight Medicaid. So the map there of the state of New York shows the many local agencies that are subcontractors to Community Service Society to create the Independent Consumer Advocacy Network in New York City. We have partner agencies at Bronx Works. Community Service Society is the lead agency. There's Center for Independence of the Disabled, where I'm employed, Korean Community Service, the Medicare Rights Center, New York Legal Assistance Group, South Asian Council for Social Services, and the Urban Justice Center. That's our partner that specializes in HERP plans for people with high behavioral health needs. So that's kind of how we're composed. And then the back of the brochure has our contact information. And then I want to make a couple of comments about home care as an option, bearing in mind that just about everybody in this audience has some kind of relationship to services from OPWDD. So my first observation is that the standard of care, the reason that you get home care authorized is that it is medically necessary for you to have assistance with activities of daily living. So that is bathing, dressing, grooming, eating, walking, getting to medical appointments. So with a little bit of housekeeping, things like laundry and meal preparation. So if you're substantially independent of those things, this is not going to be medically necessary care for you. Some people who are engaged in the OPWDD service system need assistance with some or all of those things, and some people are more self-reliant with those things. So it's a different standard of care than needing support to achieve community integration or social engagement. It is about medical necessity of those sort of tasks of the person. And so it favors people with more mobility impairment in terms of getting services authorized. It's not unavailable to people who don't have those impairments, but you have to really document with the support of your physician how this person is unable to do those things because of their cognitive impairments, because of their executive functioning impairments.
Lynn, is that
They
why
need to be-
traditionally people with an autism diagnosis solely have had difficulty sometimes?
Yes, that is
Okay.
that is a large part of it. So if there are co-occurring conditions
Like
like a
epilepsy?
seizure disorder,
Right.
if there is if there's a history of elopement, I recommend that people make sure that their paperwork includes the ICD-9 code for elopement, which has been around for about 8 or 10 years. I will put, when I finish making comments, I'll put that in the chat. You know, that's a health risk for some very dangerous outcomes. But a child with autism who can dress themselves, bathe themselves, groom themselves, eat without supervision, and doesn't elope, may be a child who doesn't qualify for home care. Then secondarily, there are some issues specific to authorizations for children. And this is both if you're getting your hours authorized by CASA, the city, or if you are with a health plan of some kind. There is a tendency to back out a certain amount of assistance as what's considered normal parenting, right? So if you're saying that you need home care because you need to help a 3-year-old with toileting, there's going to be a little bit of like, well, aren't some 3-year-olds still having accents, right? Isn't that kind of like, what's extraordinary about that? There will be some sort of backing out of the total care need of what is considered a normal obligation of parenting. And many people are very baffled by that. So you want, as you're making the request and as you're documenting the need, you want to emphasize what are the extraordinary needs of this child. Then that's most of what I want to say about evaluation and access. Then I want to mention that I've had, in the time I've been doing the work that I do, I've had a number of people who had an adult family member served in the OPWDD system, or who had a residual 95 code. They used to go to day program, but they stopped because their family situation changed, they moved, there was some disruption. But they had a historic relationship to the OPWDD system, but not so much of a current relationship. And their family members saw on the bus or on a phone booth advertising about care for your loved one and get paid. Most of those advertisements come from home care agencies that only contract with managed long-term care plans. And so when the person called that agency, they called the number that was on the advertising, and they're encouraged to enroll that family member into a managed long-term care plan. Well, managed long-term care plans are not compatible with being in the OPWDD waiver. You can't be in these 2 special programs at once. So, and maybe if you really are disengaged from OPWDD, that's not a problem. Maybe your life has changed and you don't want those things anymore. But these advertising agencies, well, I'm going to call them very entrepreneurial agencies, it's not their job to tell you that they are not the only way you could get home care. And if you could in fact keep your waiver enrollment, and maybe there's something useful that you would go back to later this year if you were motivated. But you could keep your straight Medicaid, don't enroll in an MLTC, and get your home care from the city, from HRA. But it's a different application pathway. It's the same standard of getting authorized, but it's different people that you go to. And so I just want to be clear, I'm not out there in the world to catch everyone whom this might happen to. But disengaging from OPWDD waiver, once you did all the work that we all are so familiar with about what a long road that was, seems like giving up a lot. But
Lynn,
different people are in different situations.
Lynn, I just want to jump in and really emphasize what you're saying right now. because I don't know if people realize how tricky these brokers are. These are brokers. Some of these are brokers that actually stand in front of drugstores to try to convince you that they'll give you all that you need. And the next thing you know, you've lost your services from OPWDD. These brokers are getting a lot of money for every person that they sign up that stays there for 3 months. Lynn, what Lynn's bringing up is really, I've worked with a lot of families to try to undo that mess because the brokers are very, very tricky. So be very careful before you start signing on to some of these managed care programs. As Lynn said, some of these managed care programs are fine and appropriate, but not all of them are. Sorry, Lynn, that's a pet peeve of mine.
No, if some people, yeah.
Helen, may I interject for a few minutes?
This is Simon Lau from another agency, but Simon, we didn't have you on the docket. So can you put your information in the chat and we'll share it with everybody?
Yes, so I'll do that. I'll put in the chat. I didn't want to interrupt any of you guys, but yeah, so I do work for Brax Home Care and we service the 5 boroughs and Nassau, and we do have other languages, including Arabic and Russian.
Well, we can have you present it another time, okay?
Okay, great.
So put your stuff in the chat if you don't mind, and we'll make sure that everybody gets your information. So you're similar to Chinese American, is that correct?
Yeah, and we work with pediatrics, Americare as well. Okay,
very good. We'll do that. And Lynn, I'm sorry that somebody's asking us to just, we're talking a lot of acronyms, CDPAP, PCA, home health aid. If you don't mind, just because you know everything.
All right, so the difference between, so personal care can be delivered in one of 2 modes. The traditional, we say personal care aid or home health aid, even though that combines 2 things that are slightly different, but you need to get them authorized by whomever is responsible for your coverage. That could be the city. You live in the city and have straight Medicaid. It could be a health plan if you're enrolled in a health plan. Personal care is assistance with activities of daily living, and it can be delivered in a traditional mode where the agency has trained, recruited, and hired people who they just send to you, and they are going to be strangers to you. Or it can be done in the consumer-directed mode where you take on some of the responsibility to recruit, hire, and train, and supervise and schedule, and potentially fire your workers yourself. And one of the trade-offs of that is that those workers can do a few more tasks that a traditional aid can't do. Home health aid means, and is more meaningful in the traditional model. Think of that as one column. Home health aides can do a few tasks that personal care aides can't do. They can take blood pressure, they can take weight. There's a complicated table of tasks that one can do that the other cannot. If you're more interested in consumer directed, you're not going to be so concerned about the distinction between personal care aid and home health aid, because most of what a home health aid can do, a consumer directed personal care aid already can do. People use the phrase CDPAS, CDPAS, or CDPAP, Consumer Directed Personal Care Program, pretty interchangeably. And they will use that to name the aid, the activity of you choosing to do that model, and you are to some degree administering it. Consumer directed means that you're engaged in it, either the person receiving the care or someone else in their life on their behalf to manage that person's care. Consumer directed can mean the person themselves receiving care or others in their life who are doing that managing. Did I miss an acronym?
You did it all. Thank you, Lynn.
Okay. The right, so then jumping back to my role, I'm available to advocate for anybody who is getting their home care in whatever model from a managed care plan, whether that be a Medicaid only plan or a dual plan if they additionally have Medicare in their coverage picture.
Now,
I'm
Lynn,
specifically available.
there's a couple of people who came on this specifically. They sent me messages because they are 65 and they're on Medicare and they're not familiar with the dual eligibility thing. I don't know if you were planning to talk about that at all.
I wasn't going to focus on it for this audience, but if we have some over 65s, I can spend a minute on that. Let me say
Just so
something
they're
about
aware of it,
PHP.
you're ready.
Just,
Okay.
okay. My specific job is to be available to the just under 2,000 people who've enrolled in Partners Health Plan. That is a particular dual coverage option for people who are by OPWDD. So they're in the waiver, they have Medicaid, and they also have Medicare. I'm going to save for another day the different ways that you could obtain Medicare, except to say that one is through your own work history. So you've accumulated enough employment to become eligible for Medicare for yourself as somebody who's served by OPWDD. You can also obtain Medicare because one or the other of your parents or some other people who Social Security considers parent equivalents, who has a work history and a relationship to you, has now become deceased, disabled, or is drawing retirement benefits. So when those triggering events from that person who's a covered worker and related to you happen, your federal benefits become Social Security disability instead of SSI. And then 2 years later, you obtain Medicare. So super complicated. I don't make the rules. I apologize how complicated they are. But many people, somewhere between a third and a half of people served by OPWDD also have Medicare. And it's in the state's interest to fully utilize that Medicare benefit so as to reduce our Medicaid bill, right, at the population level. So this model, Partners Health Plan, requires that dual coverage status plus being served by OPWDD. And I'm the participant advocate for all of those people. And I also can help folks who are served by OPWDD who have other coverage situations. If it's just straight Medicaid, I'm going to be pretty limited in what I can do for you. But I will help you understand the environment and get you pointed in the right direction. If you're served by managed care, I can appeal with the care plan if they haven't authorized you enough hours, which is a very, very common complaint. And if there are problems with their service to you that are worthy of a grievance, I can help you to file grievances. So those are my special powers. I want to say a couple of other things about consumer-directed personal care. And some prospective changes, some things that are coming down the pipe because the Department of Health is changing regulation about this service. One is they're going to make the standard of need a little bit steeper. They're going to say that you need to show that you need assistance with 2 or more activities of daily living, unless you have dementia. And maybe they're going to include other cognitive impairment, which many of our developmentally disabled people would fit under the framework of other cognitive impairment. And they are going to implement a special review panel that isn't any of the plans themselves for high hours cases. There's a belief at the State Department of Health that there's more of this service being delivered to some participants, then is justified. We see this all the time in calls that we receive at ICAN. So those are supposed to kick in October. And so if getting home care is something you've been thinking you maybe should do, I'm going to recommend that you do it before the third quarter of this year, because the rules are going to be changing in a way that is not favorable for many applicants. Also, the state just recently reissued the contracting guidelines for fiscal intermediaries, and several of our agency representatives on the call today, they were chosen to continue doing business in that model, but not every agency was. And so many people are going to be reorganizing to another agency because theirs may go out of business to continue doing business. So there's going to be some mergers and concentrations in this field. So I don't know how many people on our call are currently receiving this service. You may want to check in with your agency and make sure that they are among those that was tapped to continue doing business. Not every single one was. And then finally, I want to mention, whether you are an applicant or whether you are an ongoing user of service, there are two current campaigns that I would suggest you be aware of. One is Consumer Directed Personal Care Association. And you can sign up for their mailing list on their website at cdpannies.org. I'll put that in the
really
chat once I
important.
finish making my comments.
Yeah, because Lynn has really taught me a lot about, it's so important that we advocate, and it can't just be the same people all the time. We need more people to fight for this stuff, because these changes that are coming, it could be a problem, but when we advocate, we get results. Thank you for putting that up, Lynn.
So CDPANnies has been very effective in pushing back on regulations that were not reasonable, and for arguing for pay parity for our aides. So I will put their web address in the chat, but that's what their web page looks like. And I also want to bring to folks' attention a campaign under the banner New York Caring Majority. These are people who are trying to get a pay increase for home care. They want to get a pay increase to a living wage. They are a really dynamic group of folks, and I realize that we all have a lot of things that we're paying attention to, but this is a movement that's really focused on the pay equity for women, pay equity for people of color, who are this workforce in the main. Folks who are doing consumer directed are often focusing their care on people who are related to them, so they're going to be in whatever racial, ethnic, heritage, religious, language group that they are, and that's great, because it helps you probably get the most person-centered care for the person receiving care. But this also is a workforce issue in our society. At the population level, the people providing this kind of care are Black and brown women. So those are two things I want folks to be aware of as being kind of in the environment around home care. And I'm going to go add things in the chat, and I'm happy to take your questions.
So Lynn, do you want to put in a plug for the legislative breakfast?
Yeah,
the legislative breakfast?
Oh, well, I'm going to let you do that while I do the chat.
Oh, no. All I know, you do it much better.
All right, well then, so Manhattan DD Council, of which we are a subcommittee, has its legislative breakfast on Friday morning from 10 to noon. It'll be available on Facebook Live. It will be available with a translation channel in Spanish and Chinese directly on Zoom. So if you want to sign up for it,
do I have it somewhere? I can put it in the chat.
I think they're holding off on the broadcast of the Zoom link because we're aware that there are some potential security problems with over-publishing the Zoom link. We also want people to register. We'd like people to register with their counsel so that they are on that counsel's mailing list.
Yeah, and
Right,
I've
so
encouraged
wherever you
people-
live in the 5 boroughs.
Right. And even if you don't live in the 5 boroughs, if you're Manhattan or you're Long Island, you should listen because, I mean, you know, Long Island or Westchester, because it's a Zoom thing. And the more you hear these issues are all our issues. So, you know, the more you hear it, you see how complicated some of this stuff is. The more you listen, the better you get it. And Lynn, thank you for doing all that work too.
Thank you.
So Friday's legislative breakfast is going to focus on OPWDD funding, specialized schools, and some for early intervention. And it's not going to be as focused on home care directly. But many people in our population use and depend on home care. But the funding, it comes from a little bit different place in the state budget. So 10 to noon Friday, I encourage you to find us, register with your local council. You can find all the councils on Facebook and on their respective web pages. I will, Andrew has put the registration links for Manhattan DD Council in the chat earlier, and I'll find it and repeat it, that I'm gonna put these links and the diagnosis code for elopement.
Thank you, Lynn.
In the chat now.
I cannot do that. Okay, thank you, Lynn. So if you're not already a part of your local DD council, you should start attending and you should become a member of that. Now, any questions for Lynn, or I know our other speakers, I believe, are still with us. Any other questions that were not answered today? I recognize today was a lot of information. I recognize that home care is an incredibly complex topic. I don't know that anybody is a full-fledged, knowledgeable about it, but any final questions that you have for now, and I sincerely hope you've learned something. I sincerely hope those of you who didn't know about CDPAP will take advantage of it. I sincerely hope that those of you who were afraid of home care will start asking the questions. But now let me give you a chance. Are there any other questions that we have that want to?
I don't see any hands.
No hands, no questions. You're all exhausted?
Yep. Like we said, we have to do it again. We'll do it again. This stuff takes time to digest, but this will help a lot of families.
A huge thank you to our 3 speakers, Rachel, Eric, and Lynn. I've learned a lot. Eric, I was actually surprised by your presentation. I had no idea that somebody who became a personal assistant would really reap such benefits. I thought it would be a benefit for everybody, but not to the extent that how you explained it. So that is rattling around in my brain right now. Rachel, I think that your program offers, in-home services that I think so many families are clamoring for and would not have known that they can get them at home, without
so timely.
And Lynn, I always learn from you. Lynn is the cutting edge of our industry right now. And yeah, she always.
And she's so generous with her time.
And she certainly is, So yeah, we've had some 3 dynamic speakers, and I hope you all share my gratitude to them for joining us. And I certainly hope that you all gained something from today.
Carol, can I just mention just one thing quick to tie it all together, because there was a lot of questions to me privately.
Of course.
You have CDPAP, you could work with us for therapies. If you're with another home health aid agency, please reach out. We work with many, many, many providers. It's just like everybody works one big happy family. If you have self-direction, you could work with us as well. So people are getting confused. And I'd be happy to explain it on a case-by-case basis. But even if you have CDPAP with Hamas-BIG or Chinese American Planning Council, you can still get therapies from us.
Right.
So please email me your individual questions or call Calvin and I will be happy to work with you and explain.
And they are so responsive. It's not the usual, where you don't get a phone call back. You'll get a response, which is wonderful.
Thank you. Thanks.
All right, what more
A
can
wrap.
what more can one say about it all? Thank you for all for joining us. And anybody has any outstanding topics that they want us to bring speakers together with, you should let me know.
And I think Jackie and Mary in the family support group are going to be doing reimbursement in their next thing this month. So if you go to that Manhattan DD Council page, you'll see what the next meetings are. So we have the breakfast on the 5th, and then Jackie and Mary's thing is towards the latter part of the month. So that's another topic of interest. And we'll look for you guys to tell us what else you want Carol and I to present.
I just put my email in the chat. If you have something burning that you want us to figure out how to present, let me know.
I'll put mine too, if anybody wants. Thank you all.
All right, you're all stunned to silence, but thank you for joining us.
A lot of info. I think everybody's tired.
Thank
And
you for
Lynn, you're
having
gonna
us.
try to capture this thing?
Thank you so much.
Thank you, Eric. I'll look for the email in and I'll clean it up, okay?
Okay.
All right, thanks, everybody. Have a wonderful day and stay safe.
Thank you.